So as Bill said, my name's Nicoleen. I am an RN and I'm the VP of Clinical Services here at Accurate. I've been with Accurate for 12 years now and have seen lots of things change, but lots of things stay the same. We're at the core. We're providing care to our patients out in their homes pretty much all over the state of Minnesota. So really love what we get to do here. Just a couple of updates I had to share with you today. One is for anyone receiving PCA services. As you've probably heard, the state of Minnesota is changing the PCA program to something called CFSS. If you know much about the healthcare world in Minnesota, we love acronyms. Actually, that's not just Minnesota, that's everywhere. So another acronym, CFSS, and I believe it stands for, I should have looked that up. Community First Services and Supports.
Pretty close.
Anyway,
that's pretty close.
It's something along those lines. So PCA is changing to CFSS, and basically what that will mean for you if you are receiving PCA services is that after October 1st of this year, so next month, and before October 1st of next year, when you have your annual reassessment by the county will move you to the CFSS program. And so at that time, you will have two choices. One choice would be to move to what's called the budget model for services, and one choice is to move to what's called the agency model for services. So one PCA services provider, such as Accurate Home Care, can only do one or the other. We can be budget or we can be agency, and Accurate Home Care is an agency. And so if when your assessor comes out to reassess for services annually, if you were to elect the budget model, you would no longer be able to receive services from Accurate Home Care. You would instead have a budget. You would work with a financial or fiscal management service, and you would then be hiring, firing, training your own PCAs. So just something to note, if you want your services to stay the same, you want to continue with Accurate, it should otherwise be pretty seamless. Just be sure that you are selecting that agency model if that's what you choose to do. I know that might seem confusing, and maybe you're not even going to come across this for another 8 to 10 months, and then you're going to forget what I said. Don't worry, we'll send out more information, and I'm sure that your assessor will help you with that as well. But that's a pretty big change. It's something that DHS has been working on for perhaps close to 5 years. It's been talked about for a long time and is finally being implemented. Another thing that will change starting 10/1 again for PCA services is the return to the ability of family to provide PCA care. And when I say family, I mostly mean parents and spouses to provide PCA care for a recipient. If you remember back to COVID times, I know we try not to, but sometimes we think about it. Back to COVID times, family, parents, and spouses were able to provide PCA services, and then that waiver ended last year, at the end of last year. So there was a transition period where we couldn't have anybody working to provide care for their spouse or their child, and now that's changing again as of 10/1, because under the CFSS model, you will be able to provide that care. So it starts again 10/1 because you might not be reassessed until, potentially September of next year. So it's to get everybody through that gap period. So here at Accurate, we are seeing some parents reapplying to return to the position of PCA for their children, or again, for spouses as well. So that's a great opportunity for those who are interested. And then I wanted to touch on regarding our PDN service line, our private duty nursing or extended hour nursing or home care nursing. There's lots of different words for the same thing, but you probably know who you are if that's a service you receive here at Accurate. We're really excited because we're seeing some growth in that service line. So adding a couple of new patients, but most excitingly, it's easy to add patients. There are many people who have need for those services, but Of course, our constraint is always the number of nurses that we have, but we're really excited. We have seen some growth in our number of nurses in that service line as well. Recently, we've had a patient that we were able to take off of our needs list, meaning we have open hours, we have a need for staffing in that home. We've taken a patient off the needs list that's been on the needs list for a couple of years, and that's not for lack of effort. We have tried to staff that patient. We've shared the patient with other agencies because we're stronger together, right? Our goal is always to provide excellent patient care and meet the needs of the patient and family. And sometimes it takes more than one agency to do that. But that patient recently had all of their needs met because we were able to hire additional staff. So we're seeing a little bit of growth in that way, and that's really exciting. One of the best ways for us to grow our nursing staff is for us to get them right when they're growing up, right out of those nursing schools. And so that's part of my job. That's one of the things that I love to do and have lots of experience doing. For several years, I've been working with nursing programs, and some of you may have been contacted by us before asking if we can send student nurses out to your home, and we so appreciate when you say yes. And this semester is huge. Never in my 12 years at Accurate have I had this many schools that we're working with or this many patient homes who have agreed to open the doors to student nurses. So this is really, really exciting. We're partnering with at least four. I forgot one. 4 new programs just this fall, and that's in addition to 4 that we were already working with. So really fantastic opportunity to get student nurses out into our patient homes to see what our nurses are doing. And that is so important because nursing school clinicals are otherwise so focused on hospitals and long-term care settings. And sometimes it's possible to graduate from nursing school without ever even really learning about home care, believe it or not. That was the case for me. I learned nothing about home care when I went to nursing school about over 15 years ago. So there's been some changes in that way, and we are excited to be a part of that. So thank you. If you have opened your home to a student, if you are interested in opening your home to students, please reach out to your clinical manager or reach out to me or just call the office and say, how do I get a student in my house? We always appreciate those opportunities, and we would love to have a list of patients just waiting to have that experience. So that is what I had on my agenda to update everyone on today, and I will pause for a moment just in case there are any questions for me.
I do have a question. Because we do use nursing. We haven't been contacted about nursing students. We haven't been contacted about nurses. We're struggling. We are struggling. We have 1 nurse.
You bring up a great point. I should have mentioned the students are here in the metro area. So depending upon where you live, we are working with schools here in the metro area. That's not because we won't work with schools in other areas. So if you want to, I would love it if you'd reach out to me afterwards, and I can take a look at schools in your area and kind of your specific situation. Are you outside of the metro area?
Yeah, we're southeastern. We're in southeastern Minnesota.
Gotcha.
We're between Red Wing and Winona.
All right, got it. Well, that being said,
I know Winona State's got nursing program.
They do, and I've worked with them a little bit years ago. I went down there and spoke to their class, but I'm also just going to do a little quick Google map work on the side. That's the beauty of having 2 monitors, because I did just recently start with a nursing program that's a little bit farther south. And if they walked, it would take them 38 hours to get there. Why is it set on walking? I don't know. Okay. Oh, it's still 2 hours away. Darn. Well, anyway, I will certainly look into it because that's a great opportunity, and everybody needs nurses. So it is a little bit harder though when we're in those farther out areas, but that's a great point, and I will jot that down for a follow-up.
Okay.
While Nicoleen's writing, I'm going to share my screen for just a moment and show you a table that we put together that has the agency versus the budget model. And we're going We're going to have this on our website within another few days, but I thought I would go ahead and share it now, just in case somebody on this call wants to see it, or somebody comes in afterwards and watches the recording and wants to see it. But you should be able to see my screen now, and you should be able to see a chart here. Notice that there's the CFS agency and the budget model comparison. In the agency model, and I'm looking to the screen on my right here, the agency model, there's a staffing coordinator that works with you to put together a schedule. We recruit and hire and train the staff as best we can. Now, obviously, we'll collaborate with you. If you have people that are, care providers that you want to bring into your home, we'll certainly collaborate with you on that. We manage the staff performance, not you. We assist you in customizing the service delivery plan. We'll help track hours and make sure that your hours are optimally utilized. We offer a training and worker development budget, as does the budget model, but we also have a pretty robust and increasingly robust benefits package that we offer to all of our full-time employees, and in some situations to our part-time employees. I'm thinking about the 401k match there and the PTO accrual. And so you may want to take a look at that this is, even though we can't quite pay what the budget model can pay, there are other things, other values, I guess I should say, that come with using the agency model that I think is worth your consideration. So I'll stop there and see if there's any questions or thoughts on that. Okay, I'm going to stop sharing, and I think, Nicoleen, you might have one or two more things you'd like to talk about.
I think I made it through my list, unless I should come up with some other ideas.
Well, I'll go through a few other things here. First of all, while this doesn't directly affect either patients or staff, it does directly affect staff actually here. Nicoleen and I, and then Pete Empanger, our CFO, we were in Dallas last week at a conference that was put on by our EMR, electronic medical records vendor, CanTime. And they are doing some pretty nifty things with their platform that we will be, hopefully be adopting in the next, I'm going to say 30 to 60 days. And that should improve our efficiencies and our productivities, and in the long term, give us opportunities to offer better, more efficient care in all of our service lines. And so we're looking forward to that. Also, you may have noticed in our social media that we have better and more consistent messaging now. Per my directive, we are focusing our marketing towards care providers, and we're at least once a week, we're trying to answer the question, why should a care provider work at Accurate Home Care? Why home care is a larger question, but why Accurate is a more targeted question. And those are the questions that we are trying to answer in our marketing. So if you happen to see that on Facebook, or what used to be called Twitter, it's now called X, or if you happen to be part of LinkedIn, we have a page. Consider just kind of following us on social media and giving a like now and then, or a response now and then. Every time somebody interacts with one of our posts, that helps push that post up and helps it be seen by more people. So we have learned that in the last 60 to 90 days that most of those who applied to be care providers, whether it's home health or private duty nursing or non-medical PCA homemaking, the vast majority of them looked at our social media and our website. And so we'll be upgrading our website, and we now have consistent messaging on our social media. So at this point, I'm happy to take any questions or just listen to any thoughts you might have about social media or about anything else you'd like to ask about here at Accurate Home Care. Nicoleen and I will be happy to dialogue or answer whatever questions that you might have. So the one questions that we can't answer is how the Vikings and the Packers are going to do this year. Nicoleen's a Packer fan, and I'm a Vikings fan. So we have a little friendly rivalry in the office.
Packers will win. At least one of them. That's how it usually goes, right?
Yeah, usually, yeah. So, well, if you're watching this recording, feel free to send an email to myself or to Nicoleen. My email address is billenglish, that's all one word, billenglish at accuratehomecare.com. Nicoleen's is Nicoleen Meyer, Meyer, one word, at accuratehomecare.com. And we'll be happy to answer your questions. If you need to get a hold of us, you can call the main number and be routed to us as well. We are available to you at most times, not 3 a.m, but most business hours we're available to you. And we want to make sure that you're well taken care of, and make sure that you're just delighted with Accurate Home Care. So I want to thank you. Nicoleen, do you have anything else? Are you good?
I don't believe so. Yep, I'm good.
All right. I want to thank you for joining us today. And like I said, get a hold of us if you have any other questions, thoughts, or comments. I hope you all have a great day. Take care.
Thank you.